Hi, I'm Dr. Usha Kiran. I'm a consultant obstetrician and gynecologist. In this video, I will be talking to you about Down syndrome screening. Normally, we humans have 23 pairs of chromosomes, that's 46 in total, and out of which they're numbered as 1 to 22, and then the last pair is the sex chromosomes. During fertilization, when the egg and the sperm get together to make the baby, sometimes defects can happen and you get not the 23 pairs of chromosomes, you might get more or less. In Down syndrome, the defect is with the chromosome number 21. Instead of having 2 of them, the Down syndrome babies have 3 of them. This makes the babies mentally subnormal and can have some heart defects or other organ defects. These babies will have a long life and they can live as long as any of us. However, they will require support throughout their life because they're mentally subnormal. The usual incidence of Down syndrome in the normal population is about 1 in 800. So for every 800 babies born, 1 could be a Down syndrome. As the mother's age progresses from above 35 onwards, this risk increases, and the reason being the aging eggs, which are a bit more defective. So the risk can actually go up to 1 in 40. So every 40 babies, 1 could be a Downs if the mother's age is above 45. So mothers are offered Down syndrome screening tests to check if they are high risk for having a Down syndrome baby. At around 12 to 14 weeks, a blood test called double marker test is done, wherein certain biochemical markers are checked to see if you are high risk for Down syndrome. The other test is the ultrasound scan, which is the nuchal translucency scan, wherein they look at the fluid at the nape of the neck of the baby to see if the baby is high risk for Down syndrome. If for some reason you missed these 2 tests, you will be offered a triple marker blood test at around 15 to 18 weeks, which again looks at the biochemical markers to look for the risk of Down syndrome. You have to understand that these are screening tests and they are not definitive diagnostic tests. They only tell us whether you are high risk for Down syndrome or low risk for Down syndrome. If you are high risk for Down syndrome on this test, it doesn't necessarily mean that you will have a Down syndrome baby. It just says you are high risk. Similarly, if you're low risk on this test, it does not completely rule out the possibility of Downs in a baby. It just says that you are low risk. Now, what exactly will tell us whether the baby has definitely Downs or not? They are the diagnostic tests or the definitive tests. Previously, we used to have invasive tests called the chorionic villus sampling and the amniocentesis, where a little bit of the baby's placenta or the fluid around the baby is taken, and from which the chromosomes are checked to know the definite chromosome karyotype of the baby. We still do those tests, but they are not done as a first line of testing because we now have something called a non-invasive prenatal testing, which is just a blood test taken from you in which the baby's blood cells will be isolated, and then we can look at the chromosomes of the baby. So this non-invasive testing does not have any risk of miscarriage or anything like the other 2 tests that I mentioned. Non-invasive testing is expensive, hence not advised as a first line of testing. It's advised if your screening tests come back as high risk, or if you've had a previous Downs baby, or if your age is more than 40 years. Before you opt for the Down syndrome screening tests or a definitive non-invasive test, you need to be sure of one thing. God forbid the result is going to be low risk and everything is going to be fine with your baby. But if the screening test comes back as high risk, or if the non-invasive testing shows that your baby is Down syndrome, what would you like to do? Down syndrome is not a treatable condition, so you have only 2 options. either continue this pregnancy and give birth to a Down's baby, or decide to terminate the pregnancy. Both the decisions are not easy to make, and there is nothing right and wrong in making this decision. It is based on individual perceptions, beliefs, and needs. If you have decided that you would not like to give birth to a Down's baby and would like to terminate the pregnancy in case of a Down's baby, then you can go ahead with the testing. But you have to keep in mind that the termination of pregnancy laws are very different in the UAE as compared to any other part of the world. If for personal or religious reasons you have decided that you will not terminate the pregnancy at any cost, then it is doubtful whether you should be going for this test just to know whether it is a Down's baby or not. But it's entirely up to you. I sincerely hope that your baby is going to be perfectly normal and everything goes really well with this pregnancy. Good luck. Kindly check the information part of this video for a link to my blog, Dr.Usha Kiran, blogspot.com, and the Facebook link. And you can contact me on my WhatsApp number 0091 720 801 2411 for any further queries.